Storeroom.
That order. However, in cases where there are new people at the facility because of the change orders, for each facility we have someone who alerts us, okay, this is a new person that's actually mandated to order on our behalf. So once that's done, then we go ahead and process the order. So once that is also services we pick products from. So we pick from both the central RMS and then the eastern RMS, as well as the National Blood Service for blood, and then the EPI for the vaccines and the vaccine consumables. So if you are mandated to order that product per your health facility level, according to the NHI classification, they will serve you. If you are not, once we do that and we check to make sure expiry dates, product quality and everything are in order, we will receive them into our system. So for every product in the warehouse, we have attached on them unique barcodes. Now on these barcodes, we have the expiry date, the supplier, the product, the batch. It also ensures that we are packing based on first to expire as well. So once you scan a product and there's a product in the shop with an earlier expiry, it's going to prompt you that the product you are scanning, there are some there with a batch number and expiry date closer than the one you are packing. Even if it's just a month of that. When the order is also processed, scanned with the various units, confirmed, the printer will issue out a unique QR code, which will alert the drone that this is where this package is going to. And that QR code is specifically for the facility that the order has been processed. So it won't end up going to a different health facility with the commodities that they don't need. And it ensures that if I scan that particular QR code that has been issued out, I can see who ordered the product, when it was ordered, when it was delivered, where it went to, the expiry date and everything of the product inside. So that ensures we have good traceability on anything that comes within the warehouse that we send to our various customers. And if there's any issue with all
particular center, this way say it is easier to move that facility there than that will be done, very organizing of event. Do we have any facility that we are not covering? Because per agreement is 75% plus that we are in phase 4. Are there any facilities within Omenako that we are not covering?
No, any facility
for any
within
reason
that radius we are covering.
So the 700 and something we are talking about is the absolute total number of facilities.
So there are some facilities that the Air Force, these are areas we operate in, because we still work with the security forces and they do operations in that area. So if they buy us from reaching them, what we'll do is then we would not say we deny that facility a service, but that facility, what we can do for you is we can let you pick from the closest, some leeway entering these zones and serving those facilities.
It's not only here. But see, I beg you, moving forward, in our reporting, if we can pick some of these outliers.
No, it's okay, go ahead.
I want to ask about the receipts to facilities. When they receive the items, is there any acknowledgement of receipts?
Yes, so we send a proof of delivery with every package that we use at the distribution center, which the facilities will then sign that they receive their products in good quality. And then we'll take, if it's
your system with the gamers. How far has that one gone? That's the first question. 2. Your relationship with the RMS, the regional directors and the district, now that GPC, how far is it also going? Then thirdly, your product lines. You know, you mentioned the Vasila. I want it to be specific because we saw Omenako here at my areas. Is it part of your list? So that at least now that GPC and all or the policies is clear as to what you are supposed to do and what
Your portfolio of
the
products.
So
We communicate with them on a regular basis. If there are any insights we need, we call the RMSs directly, the managers. If it's about the finance accounting issue, we have the contacts of the accountants at RMSs. The district health directors, we have somebody specifically that deals with engaging them on a regular basis, just to ensure that they are always in the know. So we visit them on a regular basis, myself or that person tasked with ensuring that whatever the district needs, we are taking care of them because we are really here to serve them. And the regional directors as well, we engage them constantly. Percy, myself, Rejoice, we constantly engage them, send reports to them, have meetings with them just to make sure anything we are doing, it's in line with the direction they want for that region. Because we are guests in their house, so to speak. So we have a very good rapport and working relationship with the various stakeholders. In terms of Gilmis, we order through Gilmis to the RMSs. So we use Gilmis in ordering, we do the consumptions on Gilmis. In terms of merging the two systems, I think that is something that is still in the process.
So as it stands now, we are not able to see what is at the facility. I mean, if we had that oversight or that visibility, it would have also helped us to validate some of the orders that we get. So I think as a policy direction, we can actually consider, giving our integration process like a very full integration, so that it doesn't only offer us the visibility at the facility level, but it also offers stakeholders at the national level the visibility of our operations. So I think it's a critical part of anything that we do in terms of policy. The bit about our product portfolio. So here we actually centralize medical products, blood products, and vaccines. I think during COVID we started COVID vaccines and also COVID samples. And on the medical products, we actually deliver emergency products and some routine products as well. The idea being that we run two use cases to a large extent. We have the emergency use case and then we have the resupply use case. So the emergency use case is when you have a patient at a facility needing an emergency product, an anti-snake or an anti-rabies or a blood product. So in that instance, you staff the drone with just that particular product to deliver to the facility to save the patient's life. Then we also have the resupply use case where you have a facility going low on stock or totally out of stock. The regional medical stores will usually have like a 3-month cycle when it comes to its last mile distribution. But in between that process, sometimes you have facilities, particularly in the hard-to-reach areas, running out of stock or even going low on stock. And it takes a while for them to actually refill. So in those instances, we deliver controlled quantities of those products to them to help them get by onto the regional medical stores, refills for them. So they might order for a few packs of anti-malaria just to get by onto the regional medical store, delivers the entire bulk to them. So that's why you'd see like a Lofnac here, you see an anti-malaria here and there.
Products are delivered. Delivery reports are sent to the various quarters to allow processing of payments. Have there been situations where probably Zipline has been barred from flying or supplying a facility with products?
We don't deliver them until the regional medical stores reaches out to tell us that okay, they think they are in the good books now, the good books of the RMS. That's when it's actually started using. So an internal term that we use, which is very strong if you ask me, is blacklisting. But to an extent, we still deliver them, even though they don't get the entire remission. For medical products, we have the EPI for vaccines.
Yes.
We pick our vaccine from the EPI and also the original code names. Then we have National Blood Service for blood products.
Yes.
So those are our few.
So in case RMS hasn't got,
That's
what
a good
happens?
question.
Yes.
So our warehouses close to empty because the regional medical stores are stock. So the way we are dealing with it now is to rope in the National Catholic Health Services because to a broad extent they are also under the Ministry of Health. And we also sell them Ghana Health Service products anyway. So we actually started discussions with them on how we could also leverage some of their stock to support their facilities within the health structure. So that we have a little bit more. They're always having
So I have another. You're running hospitals. I said you're running person. I can see it's a very technical, active also. Just when you wait.
The ground is that we really struggle to support. I would want to answer the question that when you finish
Everything.
So I just wanted to add on something. So when we started, for instance, we never anticipated that we were going to support in community drives, right? But when we started, we realized that it was difficult collecting blood, and we were always not getting enough blood to ship with National Blood Service, where we partner to organize blood drives. And this alone is like an extra cost aside what we actually envisage. So I think that was what Mauli was trying to. Some of those costs that we never saw as, we never expected as being part of our operations, but are now part of our operations.
So Chief, just add something. And this is strictly ministerial. So private sector participation, we are being very careful. Now the point is made, we commend them because this is a self-motivated type of approach to make innovative, to make themselves relevant. If they sit here and there are no blood products, the place will be quiet. And National Blood Service also has its own challenges. So we really appreciate the partnership. They are even willing to give us machines that we can put at Tamale Teaching Hospital, Olga, and I think there was one too in the Eastern region that we are considering to produce more blood. We think that this relationship will move forward once we have that type of support coming from them. Apart from the pure commercial between us, they are also looking at the social corporate responsibility. So we encourage them to do that. That's going to be useful. Despite the fact that we owe them. They're still helping us.
I wanted to deliver rice and
So my last, and I want to ask again, I don't know how you call it, your rate of, are you working below capacity or?
Okay, that's a very good question. On the center. Yes, so Eastern Region, Ashanti Region is a bit more cosmopolitan than the other areas that we serve. So across our 6 distribution centers, our highest deliveries are in our distribution center in Kiti, our distribution center in Wale, our distribution center in Western North, and our distribution center in Eminemi, because they typically serve like the more rural areas and they have like a lot more of their facilities in hard to reach areas. But for our distribution center in Eastern and Ashanti, their deliveries are not as high as the others. So across the country, on an average, we now do like 2,500 deliveries a day. We've done as high as 3,200 deliveries in a day. And our distribution center in GH3 actually goes as high as, the highest they've done is 250? 320 deliveries in one day. And it was during the rainy season when you had a lot of...
You exceed.
Yeah. But I mean, other distribution centers also do lower than that, so it evens out. So that's how the service utilization profile looks like.
So, and this is suggesting, you know, that the supply framework they do a last mile distribution. That one, the ministry cannot force you to do that, but you can discuss with them. Those who don't want to go far on their own, you can link up with them so that you take the delivery to the farmers for them. That's the part. You need to get the pure and the other associations. So we discuss with them and see how much, because they are supposed to do last mile. They are supposed to take it far. But then if they don't have the facility that you want to support them, it's a relationship between
I think it's a very good idea, and we've actually had that feedback from a number of districts. So we've actually learned over the years that usually when districts are sending over their sites to these LMD 3PLs, there are times when they don't include the very, very hard to reach facilities because they can't be reached. So the farthest that the 3PL will go is to leave it at a district, and all those facilities will come and pick it up. So we've actually been nursing the idea of using a sole distributorship support kind of model to expand the last mile reach. So in an instance where these facilities outside the sites chosen are in need of last mile products, we can actually deliver to them so that the ground logistics of the 3PLs can focus on the accessible ones. And I think again, there's something that can be also looked at the policy level.
You how do you distribute? So you have a protocol.
That's also a very, very good question. So we have, when we started, we put together a standard operating procedure together with the Ministry of Health and Health Service. And the clause that was inserted in the procedure was that we can't accept products that are 6 months due to expiry. So we actually always stick to that particular I'll explain it later on, but I think this is something that could be considered by the ministry. For instance, when it comes to our anti-slave products, with 1 year close to expiry, it would be a good idea to collaborate with Zipline to legally distribute them so that we don't have a lot of them expiring on our hands, because we have like the leverage of reaching out to a lot of facilities at a very short period of time than what the ground logistics will be.
You had one.
Yes, so he was asking if we have a blood bank here. I was explaining to him that we have a relationship with National Blood Service, like Chrissy mentioned. So we pick the products from them, and then we mostly would pick units that we've observed from the trend of delivering to facilities that these are the blood groups that normally are being ordered for. So as much as possible, we pick units that will move out fast to these health facilities. However, just like with the medical products, we have that relationship where if we pick the unit and
you have backup. So we have a fulfillment system, like it's a proprietary product of ours. It's a fulfillment system that we use in managing the products here. And I'm sure.
Yes. So what we have it on the cloud. We have it on a local server as well. But we have a manual system, so in case all the systems fail, we can still process orders to help facilities. We have an arrangement with some of the districts, Okre and then Asidemanso across in the Eastern region, where for certain health facilities that are difficult to access by our network, we pick just the vaccine component of what those facilities like based on their forecast, house them here and those facilities order. So these vaccines and blood bags are available. But then the thing is, once we started operation,
Is this single? No. Single bag.
yes, so these are concentrated red cells. So once we started operations, what we realized was there was a heavy use on the whole blood bag, whereas certain conditions would just require using plasma, for instance.
Can you explain to us? You screw at 8 plus.
Yeah.
Make it 8.
For instance, this is the positive terminal and the negative terminal in your body. So if we give you a negative terminal and you have a positive terminal, then we'll basically shut your system down. Chief cells, the platelets, and then the plasma. So what we realized, once we brought it on board, we got a number of facilities now ordering more for the plasma, even when the concentrated cells are not available, because the cases they had required that. However, the investment to use plasma required you having a freezer that goes into negative 30 plus, and then before you use it, you also require a tower that will. So this is the plasma to bring it back to the body's temperature in liquid form before you can administer it to the patient. So even if there is no blood and the condition warrants, then you can use the plasma to sustain the patient up until you get the blood. But having this in every health facility is going to be quite an expensive cost.
So this one, you just receive this one?
Yes, we just receive it. So
We scan into the system.
into the system before we can. University of Ghana, just to make sure that when we fly a vaccine from here to a health facility, 45 degrees, the integrity is still there. Even if it's 2 to 8 degrees, what does the drop do to the protein chains in that particular product? Because we can maintain it 2 to 8, but if it drops and it has any impact negatively on the product, the patient doesn't benefit. So we always do those studies before we send out any new product, just to make sure that what we are sending, quality-wise, it's still the same and it's not compromised. So the blood, the vaccines, the medical.
Other facilities?
Yes, so the other facilities are actually more spacious.
More experience with this.
From here.
Yes.
Now that
More
because-
experience.
now, and more money, so you know. Yes. Oh, okay.
Our warehouse is very
On the product before we deliver it. This package is able to actually deliver
cold chain medication. So we've done validation studies to show that we can have vaccines, for instance, in the package for like close to 2 hours without the vaccines going bad. But what I wanted to show you is explain imported, but we have like a team that we've had from the very communities that we find ourselves to think on how to sellotape it and all that. So that's how we just take it done.
And get there, somebody's there.
Yes,
So
so
course that the person has paid attention.
exactly. So they are, because of their terrain, they are not able to call us, but they have an idea of how long it takes for us to deliver. So they'll actually call us and start counting. When it gets to that point, they will go to a specific place and retrieve it, even though they don't have like network and all that. So that's how.
Community, just to know that if you see this here, it's for the health facility, it's medication. Don't touch it. Just to make sure that you don't have a situation where there's a conflict between
24/7, you must be connected to electricity, proper power source.
Yes. Like continuous.
With the package, it can go up to 22 kilograms. So you can imagine having to carry 20. Modular approach, it allows us to break the drone into 3 main components. We have the body, we have the wing, and we have the battery. So we'll start with the battery. You can come closer. Weather information, whatever the drone is, will be here. Send it to the drone and then sit it out. If it's orange, that means it's sister is charging, so it has to be charged to the next one. SIM cards in here because you have to be able to have communication with the drone at every point in time. The principle here is just like what you see Uber and Bolt do. The drone will deploy a parachute. Every drone has this tube in here which has a parachute down here. So in the case where we've had technical malfunctions or we are no longer able to apply the regulations, the drone would deploy the parachute and that brings the drone speed down from it to make sure that that can see that. So once you set the battery into the body is going to do a self-test and be sure that it has enough battery to do that route. If it doesn't have enough. So when the drones
Where is Susan? Let's box Susan into one of the drones and fly her to
the package, this will contain the medicine, the parachute for the package is also put in there, and then the payload doors are closed. That's it. Let's read our first.
The routine.
The drone returns.
And the drone returns and they'll catch it here.
Modular design. She didn't have to carry 22 kilograms for a long time. That speed was shared between the four. You can see here, this is the drone that we just launched. We just passed.
For the thing to show me, so press. So we should go now.
These are some of, if you on the recovery system, if you look on the floor,
We have those towels there for the police.
Do you have intruders for now?
For now, we have not had any incident. We've had one incident of
Are you accepting?
We needed to pay a working visit to Zipline facility to see how they are meeting us halfway to achieve our goals of making medicines and other important health products accessible to patients. So our main goal is towards universal health coverage. So along the line, the partners we need to help us support in these things. Regularly, it's important to touch base with them, see what is going on, touch base with the reality of their challenges. Then we use that to strategize the goal. So our coming here, getting closer to the challenge, like I said earlier, makes us feel a part of it, and we share in their concerns and also their successes in also meeting us halfway in delivering products to the communities, especially the hard to reach areas, areas that we know is a challenge that we can. And I think we are impressed so far. They are very professional in nature. The place is beautiful. The technology is great. It's exciting to watch and to also see that they are really helping and saving lives. I think it's a good thing. We need to support through and through. It's a private sector collaboration, yes, but it also brings us closer to improving our public-private partnerships in some of these things as we move closer to achieving our universal health coverage goal that we have set ourselves to. I am happy, very impressive, and I really want to come here unannounced once to see if it's not stage managed, but the cleanliness, the professionalism, and the way they go about their things is up so that we can continuously engage them to help us to move.
Thank you very much.
Thank you, sir.
Yeah. Okay. So we are excited to host the Ministry of Health here at Zipline Omenako today to deepen our collaboration with the ministry. Zipline has been in operation since 2019. This is one of our 6 distribution centers scattered across the country. We've had a very interesting journey with the Ministry of Health, and we've had a lot of learnings from that particular partnership. We are happy that the Ministry of Health is here today to share feedback on our operations so far and also give us insight into how we can better improve the collaboration that we have with the institution.
Okay, give me one line about it.
We have 6 distribution centers scattered across the country. From these distribution centers, we serve close to 3,000 facilities, with 50% of them being in very hard to reach areas. We've helped to minimize stockouts in some of the facilities that we serve by delivering controlled quantities of the products we receive from the ministry to some of these facilities. We've also helped to improve emergency response to these facilities. Now you could have a facility having a pregnant woman in the middle of the night needing blood products, but the facility still being able to see to this particular pregnant woman. So we've also helped to enhance and improve response to disasters across the country. There was one instance in the Northeast region where we supported the regional medical stores to distribute medical products and also other kinds of products to facilities that were cut off during the rainy season in the northern region. It helped to manage some of the disease cases that they had.
When I got it in the morning, I think we did some tests.
We are done.